Switching gears now to a growing concern in Prince George's County, gaps in prenatal care. Right now, most women are leaving the county to deliver their babies, and Black mothers continue to face higher risks of complications. Local leaders are working to change that right now, starting with community outreach and new investments in care. This is a great thing. So joining us now is Temi Oshieye, who is the Director of Community Health Improvement for Luminis Health. Temi, thank you so much for taking the time with us this morning.
Good morning, and thank you for having me.
Okay, so first of all, tell us about the community baby shower. What's the significance of this event, and how does it really support the overall mission of closing those health disparities in Prince George's County?
So think of the community baby shower like any other baby shower, right? You have fun, enjoyment, you have engaging music and resources for a mom. But the only difference in this case is you have multiple moms. We will be having opportunities for our women to learn more about different issues that they face during pregnancy. So gestational diabetes, preeclampsia, talking about postpartum depression, but also really an opportunity to educate the community and bring more resources to women where they are exactly in the community. It's an opportunity to really bridge the gaps and the disparities that we face within Prince George's County.
Tell me for you personally why this is such an important mission to help close those gaps.
For me, the personal reason behind mine is I have three children, and I live in Prince George's County, and I have two daughters. And for me, I don't want us to have the same conversation in 15, 20 years when they're getting ready to have their own children. I want the data to be different. I want the health outcomes to be different from them. So for me, it's a personal mission really to address the care that Black women receive in Prince George's County and how can we improve those health outcomes in the long run.
Yeah, this is just such important work you're doing here. And we're hearing that more women are delaying some of that prenatal care. So what's really driving that trend? And can you talk a little bit about what kind of risks are associated with the delay in care?
Yeah, so a lot of the issues related to that is the access to care itself. So, as you alluded to, 8 out of 10 women leave the county to have babies outside of the county. And like I mentioned, I have three children. I also live in Prince George's County, and I had all three of my children outside of the county. So that's one of the big factors is that access to care. Also, there are many other factors that influence it with transportation and insurance and things like that. But one of the things that we are doing here at Luminis Health is really to bridge that gap and bring high quality care right here in our backyard at the northern part of the county. So next month we'll be breaking ground on the Women's Pavilion at Luminis Health Doctor Community Medical Center in Lanham. The goal is
Wow.
that we will be able to support delivery, labor, as well as postpartum care. Now, the goal is that we're able to open late 2028 and be able to accommodate 2,000 births every year.
That is absolutely incredible. Is that lack in care right now until, of course, your center is built and that'll hopefully close it a bit? But is that lack in the amount of care and the care options in the area, is that fueling some of those higher maternal mortality rates, specifically amongst Black women that we're seeing?
Yes, because the earlier you're able to access care, the earlier you're able to identify some of the needs that might be there. So, a woman that has high blood pressure will probably later on have preeclampsia. So, if you're able to identify those risks very early on, it really does lead to healthy pregnancy and healthy baby. So, being able to identify those risks with high blood pressure, diabetes, and really be able to prevent low birth weight, preterm labor, just things like that is really what we're trying to address.
All right, Temi, thank you so much. She joins us with Luminis Health. Thank you for your time this morning. It is incredible work what you're doing, and hopefully we can close those gaps.
Thank you so much for having me.